Big changes are on the horizon for Centene's Medicare Advantage plan members. I've got some important news to share with you today that will affect you during this upcoming annual enrollment period. Almost 40,000 Centene Medicare Advantage members are going to be forced to select a new plan for the 2025 year. If you currently have a Centene Medicare Advantage plan, coverage will be good through the remainder of 2024. So if you're enrolled in a Centene Medicare Advantage plan, it's more important this year than any other year before to keep an eye out for the annual notice of change that every Medicare Advantage company has to send to its members each annual enrollment period. Many people overlook these notifications and just throw them away, assuming they're happy with their plan and they have no desire to shop or change plans. This year will be different. I highly encourage you to not overlook this notification. If your plan is being terminated, you will actually receive a second notice that refers to the plan not renewing. If your plan is staying in place, that is when you will generally receive an annual notice of change about any minor benefit detail changes going into the new year. Hi, my name is Mark Pripp, and I've been helping people understand various Medicare plans for over 15 years. This will be the 6th video that I've made on 6 different Medicare Advantage companies dropping members as we enter into the 2025 annual enrollment period. Let's get right into it. I've pulled this article from Newsweek.com, and I will list this source in the description below so you can read the full article. This is a statement from Centene CFO Andrew Asher. He says, "We've said before that we expect to shrink in 2025 as we think about what business is going to serve this well in the long run. First, we've got to chip away at the degree of run rate, negative margin, and push towards break even, and then we can talk about what the margin opportunity is in Medicare." What's happening is the company is taking in a reimbursement rate from CMS. And with that money, they're able to build the plan, give you a policy, set up the network, and pay the claim. So when they receive that reimbursement rate, that structures everything, and then that money goes out to pay claims. What's happening this year is the money that's coming in from CMS is less than all of these companies anticipated. So now that they're receiving fewer dollars, they're having a harder time paying claims and not being negative. So let's take a look at who this will affect. If you do have a Centene Medicare Advantage plan, it actually gives us data on which states will be affected. Let's take a look. Looking at Alabama, Massachusetts, New Hampshire, Rhode Island, New Mexico, and Vermont. Roughly 37,000 Medicare Advantage members will be impacted by the market exit. Vermont is especially vulnerable, as Centene previously had control of 9% of the market. So if you're in Vermont, there's a much higher likelihood that you will be receiving a non-renewal notice. What can we do about this? Again, I emphasize at the beginning, check your mail to determine if you're just receiving a plan change notification or if you're receiving a non-renewal notification. Should you receive a non-renewal notification, here's my 2 tips on what you can do as we come into this year's annual Medicare enrollment period. If you've lost your plan and you want to stay with a Medicare Advantage plan, here's what would expedite the comparison and shopping process. And this is what I tell all of our clients. Make a list of your medical doctors, hospitals, any medical facility that you use. Get the correct spelling of the facility and the doctors and the locations. That way, when you are comparing your current plan to a new plan, you can ensure that the new plan covers all of your providers in network to make sure your cost is as low as possible. The second recommendation is make a list of your prescription medications. The correct spelling of the name and the dosage is very important. Those 2 things usually slow people down when they go to compare plans with an agent. You can also look at Medicare.gov for alternate options, but having that personal information available will help you be prepared to compare plans that are the most suitable for your list of doctors and your list of medications. So during this year's annual election period, which runs from October October 15th through December 7th. That's the greatest time that you can shop and compare plans. Now, you will have a second option. If you do receive notification that you're losing your Centene Medicare Advantage plan, there is a silver lining opportunity here. Take a look at what I mean here. If you've lost your plan and you want to switch to a Medicare supplement, or also known as a Medigap plan, because your Advantage plan will not renew, you will now have a guaranteed issue rights period, meaning you receive a period of time where you can avoid medical underwriting when applying for a Medigap plan. If you've wanted a supplement or Medigap plan in the past, but have not been able to due to medical reasons, you now have a period that you can enroll in that Medigap plan with a guaranteed issue. That means when you go to apply, you just state loss of coverage. You will probably need to provide proof that you lost your Medicare Advantage plan with Centene, but that will allow guaranteed approval with that Medigap company. A lot of people prefer Medicare Advantage because it's lower cost per month. If you can see the opportunity with the Medigap guaranteed issue right, I would highly, highly recommend you consider it. Yes, it's more cost per month, but a Medigap plan works much different than a Medicare Advantage plan. And here's a couple of ideas of how they're different. With Medigap, you do not deal with this reimbursement problem that Medicare has with the company. That goes away. The second thing is, probably the most important fact, is Medigap plans or Medicare supplement plans do not have prior authorizations. What does that mean? All Medicare Advantage plans have prior authorizations. That means that when you need certain testing or care, you have to sit and wait for the insurance company to approve that procedure. With Medigap, there are no prior authorizations. That is a significant difference in how your healthcare is handled. Also with Medigap, there are no provider networks, no provider disputes between the company and the doctors. There are no referrals. You can go virtually anywhere in the United States that original Medicare is accepted, and again, no referrals. So Medigap, yes, has a premium per month. Let's say it's between $150 and $200, but the coverage is far, far superior when compared to Medicare Advantage. So here are my final thoughts. As I said at the beginning of the video, this is the 6th company I have done this exact same style video on, because it's happening so much in the industry during this year's annual enrollment period. If you have any questions about these changes or how to navigate them, please comment below or call me direct. This is one of the things that we do on a daily basis. We are helping people compare and find new plans due to this massive loss. Again, my name is Mark Pripp with Policy Guide. Let us know if there's anything we could do to help. Thanks for watching.